Ever wondered what safety measures we take in our OT?
So today, let's talk about something that's very important as to what safety measures do we take inside our operation theaters. Come, let's have a look. First and foremost, you need a biometric signature to get in the operation theater. Nobody can get into it just like that. Come. So when you get here, this basically is the sterile area. We have autoclave machines that sterilizes all the instruments and everything that you need, plus some machines right in this area. This is also the area where the doctors, the nurses, they change into their clothes and the footwear is removed and they get into the footwear that is absolutely sterile and used in the operation theater. There are a couple of machines that we have here, which is called as one as the autoclave machine. This basically sterilizes everything which is by steam under pressure and removes all the bacteria, viruses, funguses, any parasites or anything that may cause infection to a patient. The second is what is called as a fogger machine. This basically is put in the operation theater a night before your surgery. This sort of gives out a certain disinfecting chemical in a fogging very small liquid state that goes throughout the OT and sterilizes everything that is in the operation theater. So these are the two main machines that we have outside. Now come, let's have a look inside the operation theater as to what all we have to keep you nice and safe throughout your surgery. Come, let's have a look inside the operation theater, what we have for you. Now coming into the operation theater itself, there are a couple of machines that are absolutely important and necessary, without which we will never be able to do these surgeries. These are our anesthesia machines and the monitoring machine. These are the machines that will keep you safe, keep you alive when you're having the surgery done. This itself is an anesthesia machine. It's a workstation. It has a lot of parameters that an anesthesiologist measures. It has gas flows in and out of it. It has a machine called as which takes medicines that get you onto sleep very quickly, and it also wakes you up quite quickly where you're much fresher. So these are called as gas machines, gas inhalational anesthetics, which we use and is specialized for the machines. This may look like a tiny machine, but this is the heart and soul of what an anesthesiologist needs. It's a machine, it's from Philips, one of the best ones out there. It's a compact machine that can tell you everything about what your body is going through, your heart rate, your blood pressure, your oxygen measure. It can also tell you things like how much CO2 you are breathing out, which is very, very important for us to know, especially during a longer surgery. It can tell you other things like the ECG, which is the echocardiogram of your heart in real time, which is monitored all throughout. Coming from this, so of course this is the main part of the operation theater. Coming from this, there's another thing that we want to do, and which is this machine. It's a machine that the day when any surgeon or any doctor gets it into his hospital or his clinic or his setup, they would want never to use it. It's a defibrillator, or commonly known as an AED machine. It's a machine that you would have seen on a lot of airports, first aid where security is there and all of those things are there. This is a machine that is used if your heart suddenly stops, and it can sort of automatically detect as to what is the issue with your heart and give you the shock that is needed in the amount that is needed. We replace this periodically as in when the company tells us, and till date we've never used it and hope we never use it ever. Another important machine that we have for long surgery, especially surgeries like liposuction where the patient gets a little wet, where a large area of the patient is also uncovered in a cold operating room, is this machine. It's called a warmer. It basically blasts warm air out of it and keeps the patient warm along with a warm blanket that is kept. This machine is also put outside in the OT after the OT where the patient has finished the operation, because usually there as well they feel a little cold immediately after surgery. So we give this in the ward as well. Next machine we have is basically what is called as a DVT pump. It's a small compact machine. If you have a look, so this is the machine. This is basically the cuff, or it's something that is put on the legs of our patients. So this goes on one leg, there will be another similar cuff that goes on the other leg. What the machine does is basically it inflates the cuff under a specific pressure, and it sort of massages that calf muscle. This is very important because during long surgeries, when the patient is lying down for long times, and in surgeries especially such as a tummy tuck surgery where we're increasing the pressure inside the abdomen, there is a higher risk of what is called as DVT or deep vein thrombosis. To avoid this machine is a lifesaver, because this is one of the only complications that may lead to death during a liposuction surgery, because these clots, blood clots that may form in the leg, can travel into your lungs and stop the breathing. And so again, this is one of the most important machines that we have in our operating setup for long surgeries. The next few machines that you need to know about are this lipo tower along with the cautery that we have. This is very important for not only giving improved results with liposuction, but also increasing the safety of the procedure. This is an infiltration pump. It basically helps to infiltrate the fluid faster, decreases OT time, and improves the way we do liposuction. This is the US FDA approved micro air power assisted liposuction machine. It is my absolute workhorse, without which it becomes very difficult for me to do all of these surgeries. We do liposuctions nearly every day, and this is the machine that gets me through all of that. This is a standard cautery machine. This again helps with the procedure when we are removing any skin or cutting into your skin, because it is needed to sort of stop any blood flow, any blood or any bleeding that is happening during the surgery. It's a standard machine that is there all over for in every operation theatre for sort of any of these surgeries. Finally, this is what is called as the ultrasound assisted liposuction machine. It is a liposaver. Again, a CE approved machine. It's something that is doing really well, and it helps us not only give better results, but again increases the safety. And all of these machines we have spoken about much more in detail in our previous videos. Finally, when we come to some other things, is something that you need to know. You see, so how these packaging are done for these machines. So this is something where things that we are going to reuse for surgeries after every patient, such as a machine handpiece, the electrical wiring. What we do is we don't just sort of clean it, scrub it and get it again. We do something called as ETO process, where we sterilize using gas, and it then comes, it's sort of, we get this in sealed packages, and then we can reuse it again, knowing that this has completely sterilized. It's written as to, you know, when the ETO was done, for whom it is done, and all of that sort of comes in the sterilized package, which is very again important for patient safety, for the sterility, and so that we don't cause other complications again after that. There are many other such things in our operation theatre, small and big, that we take care of, so that precautions are maintained for your safety, which ultimately is paramount, especially in aesthetic surgeries. And we don't want you going back with complications because of these safety measures. So guys, that was all. These are all the machines, and a lot of these machines will be used during any of the surgeries that we do in our operation theatre here at Skinzone. We still have a lot of other small things that we do use, and it's difficult to show everything. But if you have any other queries regarding the safety precautions taken for you during our surgeries, do get in touch with us, and we'll let you know even more about it.